Steve Derrig had always dreamed of becoming a fireman, and at age 24, that dream came true.
Oh, Steve's a great guy. He's a fun guy, the type of guy that is just easy to be around. He was the type of fireman that all of us sort of strive to be.
He always said he tried to treat his patients like he would treat his own parents.
I think my favorite part of the job was the camaraderie. It was fun, it was rewarding, it was an experience I would never want to replace.
How many people get to ride on a fire truck? And we get paid for it, so that's pretty special.
But in October of 1999, Steve's dream life began to darken.
When I first started not feeling well, it really came on gradually. I'd try to take it in a deep breath and was just unable to do that.
At first, I thought that possibly he could have inhaled something that's causing him not to be able to take this full breath of air.
At the time, too, Steve was doing some remodeling in his basement, a lot of dust and whatnot. He thought at one time that he just got exposed too much to that.
Steve hoped his breathing problem would resolve itself, but a month later, he was getting worse.
After a while of me riding him and it getting a little progressively worse, he promised me that after the holidays he would go and see his family physician if it didn't clear up.
So I made an appointment and he listened to my lungs, vital signs, and he decided that I had pleurisy.
Pleurisy is an easily treatable inflammation of the lungs. It is most commonly caused by viral or bacterial infections. Treatments vary. But in Steve's case, he was prescribed steroids to reduce the inflammation.
So we started him on prednisone, and we thought that it would clear up within a week or so.
When I first heard that Steve might have pleurisy, I actually thought, well, good, because I thought this is something we can deal with, this will be easy.
But by the end of the week, I found that not only was I not any better, but I was in fact getting worse. When I went back in to see the doctor, he still thought it was pleurisy, did a chest x-ray. Chest x-ray came back negative, and he just increased the prednisone that I was taking. Said this should knock it out and I should be fine.
Being a firefighter and a paramedic, he is very level-headed and very easygoing, and I just don't think that at the time he was overly concerned.
Over a period of a few days, I continued to take the prednisone, and the symptoms were the same, but were gradually getting worse. I went to see the physician again. He was a little more concerned. He said, I agree, there's something going on. You look sick to me. I'm going to send you down to the hospital, and we will run some more extensive tests and get to the bottom of it.
At the end of January, still struggling to catch his breath, Steve checked into the hospital.
They began a series of tests, chest x-rays. Again, everything was coming back normal. On the second day that I was in the hospital, a pulmonologist came in to see me, and at that point, he had determined that I had asthma.
The asthma diagnosis was a little bit shocking because Steve never had any problems with breathing.
He said it could have been something as simple as something that I breathed in during a fire, and he prescribed some inhalers, and again thought that if I followed this course of treatment, the asthma would be resolved.
Not that we're doctors, but we've seen a lot of asthma patients, and Steve's signs and symptoms really did not present as asthma.
At this point, I'd been taking the prednisone for approximately 3 to 4 weeks, and I was having some side effects. It was making my face start to swell. And a couple guys, they would come in the station and laugh. Thought my head looked like a basketball.
Steve's a small guy to begin with, and I've always been heavier than he was, so I used to joke with, hey, you know, it's about time you're getting fat like me now.
Soon, the side effects of the steroids began to affect his job.
While I was on the ambulance, I could tell my hands were a little jittery, and I was having a hard time doing small tasks.
It just didn't seem like any of the medications that they were prescribing were doing their job.
I remember telling her, when I die, I just want you to put on my tombstone, I don't know what was wrong, but it wasn't asthma.
Neither one of us were really looking the other in the eye and saying, I'm scared to death.
But according to the Derrigs, Steve's doctors did not appear to be concerned.
The doctor kept urging him to take the prednisone and slowly over time kept bumping up the dosage.
And he changed my inhalers and again said, I feel like this is the proper treatment. It's just going to take a little bit of time and you should be feeling better.
Desperate to get well, Steve took his medication faithfully. But soon his breathing had become so bad, he couldn't even perform simple chores without gasping for air.
Every time Steve went up the stairs, he was breathing very heavily, making noises. It was just a real grumbly noise. He was just gasping for air and struggling to breathe, and it just continued and continued to get worse.
His kids were young. Just to play with his kids, he was just out of breath and couldn't play. And it was just such a different Steve than we remembered.
Despite his unrelenting symptoms, Steve still insisted on working.
I was just forcing my way through a day. I started talking to the guys and I thought, wow, you know, I think I should drive the truck. Driving the truck was a less demanding job than sitting in the back.
That was a hard thing for Steve to do, but a necessary thing at that point in time. As firemen, we like to be in where the action is.
I felt like I was letting the guys down. I felt like I was letting myself down. I was trying to work. You know, I wanted to go into work. I wanted to do my job, and every day it was just getting harder.
That's when it started to get real scary because that's not Steve. Steve's not the kind of person to take that kind of help.
I remember one day in particular when we pulled up on scene, everybody got out, went to the fire. I remember falling to my knees and trying to crawl my way up the truck. I was 33 years old. I'd always felt younger than my age, and I think at this point I felt like an old man.
At age 33, fireman EMT Steve Derrick was having trouble catching his breath. As his condition deteriorated, doctors prescribed a host of medicines, including steroids. But he wasn't getting better.
I would call the doctor, tell him all the symptoms. I think he believed me, but he was discounting it somewhat on the fact that, well, I was still going to work. How sick could I really be? At the fire station, I found myself putting the pulse ox on my finger.
A pulse ox, or pulse oximeter, measures the amount of oxygen in blood. A normal reading is 98 to 100, but Steve's was in the low 80s.
I would lay down on the bed, my heart was racing, my pulse ox was dipping. I would find myself in the back of the med unit, and the guys would hook me up to the heart monitor, and everybody was just shaking their head. Steve, you look horrible. You look worse than the patient we just brought in.
In a panic, Steve called his pulmonologist.
And at this point was the first time that he agreed. He said, Steve, I don't think you have asthma. He thought that I should see a cardiologist. There was a possibility that I could have a hole in my heart, and he wanted me to have the cardiopulmonary stress test to check for this. I immediately called Melissa, and I said, finally, he's listening.
He was so short of breath, he couldn't even have a conversation with me. And I realized we were kind of getting down to the wire. I called my brother-in-law and I said, you need to take Steve to the hospital. And he said, I was taking him anyway. He just collapsed in the driveway.
And I remember we stopped by my house and I said I just needed to go in for a minute. And I walked in the house by myself. I remember going up and walking through every room of the house. And I thought, this is it. I'm never going to see this house again. And I knew I was dying, and I thought, this is it. I'll never see it again.
I had gotten a call from his internal medicine physician to ask me to see Steve because of his shortness of breath.
Dr. Schaub walked through the door, and I was just so relieved. I wanted to cry. I thought, he's gonna figure this out.
I reviewed his chart. His EKG was normal. I reviewed all the labs. Essentially, everything was normal. And I'm going, well, okay, let's think harder here. What's going on?
And I said, here's what happens. I said, if I would get out of this bed right now and walk to the door, I said, my oxygen saturation is going to dip quite a bit.
And so I walked him through the hallway, and after approximately 50 feet, I read 74%, which is significantly down.
And I said, are we going to do the cardiopulmonary stress test? And he says, no, we don't need it. He says, you've already failed that test. We're going to move on to the next one.
Physicians are trained to develop a differential diagnosis. In his case, he's short of breath. So you have to think, well, what are the things that can cause shortness of breath? But the usual things were looked at, and the usual things were not found. So we have to look for unusual things. And that was my approach when I evaluated Steve.
He was looking around the room, and he said, I've never really done this next test in the emergency room before, but we're going to do it right now. He said it was called a TEE, transesophageal echocardiogram. They would be able to determine from that if, in fact, I had a hole in my heart. And when the test was over, he said it did not appear that I had a hole in my heart, but the next morning they had scheduled a heart cath before they could completely rule that out.
Despite lingering questions about Steve's heart, Dr. Schaub began to suspect that perhaps they were looking in the wrong place entirely.
In my training, prior to becoming a physician, I was a paramedic. And I had an opportunity to obviously be sensitive to the exposure which a fireman paramedic can be in, meaning exposure not only to the toxic fumes of a fire, but to the blood and blood products that you are exposed to when you're at an accident scene. So I mentioned to him that I'd like to get in blood work that looks at not only inflammation, but also infectious causes.
By the time his blood was on its way to the lab, Steve's wife, Melissa, had reached the hospital.
When I got to the emergency room that morning, the cardiologist that they had called in met me in the room, and he said, your husband is very sick. We are going to try and figure out what's wrong with him. And he said, I just hope we can do it before it's too late.
The next morning was the heart cath test. It would give Dr. Schaub a detailed picture of the inside of Steve's heart.
One of the few things I remember about the heart cath is that feeling when the catheter goes into your heart, you can feel that flutter as it enters in.
The oxygen levels in all the chambers of the heart were normal. With that information, it almost eliminated the heart as a potential cause for a shortness of breath.
Dr. Schaub told us, a hole in your heart we can fix. He said, this is something else. And I got the feeling he wasn't sure that he could fix what this was.
I just remember being scared. I wouldn't say I was comfortable with the idea of dying, but I think at this point I was willing to accept the fact that maybe that was going to be the outcome.
I was talking to the phone to Melissa. She was home. She had just come home from the hospital, telling me how scared she was and asking me, how am I going to plan the funeral of my husband? I can't do it. So, sorry.
It brought me to my knees, and I said, I cannot live without him. I can remember praying and saying, I can handle anything it is, whatever it is. I just can't raise 2 children without my husband.
Thursday morning, when I saw Steve, I walked in his room at approximately 7 in the morning. He was the first patient I saw that day. He was on 100% oxygen. He had a temperature of almost 104 degrees. He had a heart rate of approximately 140 beats per minute. And he looked at me and says, I'm dying. I think he was.
Desperate for an answer, Dr. Schaub rushed to see if Steve's blood work was back yet.
I went to the hospital computer system, pulled up his name and his results, and on the screen was the reason for him being so sick.
Steve Derrick, a fireman EMT, had always been the portrait of good health. But at 33 years old, a mysterious disease is slowly killing him. He is unable to catch his breath and is in the hospital fighting for his life.
And I remember Russ and another friend of mine came in to see me that morning, and I could see the look on their face. They were concerned, they were worried.
Then a doctor came in the room and asked if we could please excuse him. He wanted to have Steve and Melissa alone and to talk with them.
They left the room, and the doctor shut the door, and I remember he took a deep breath. He was standing at the end of the bed, and he says, "I'm afraid I have some terrible news." He says, "You have AIDS." Couldn't believe it. I thought that was the death sentence. But he was confirming that I was gonna die. The only difference now was that we knew what it was.
AIDS, or acquired immunodeficiency syndrome, is caused by the HIV virus in the final stages of infection. The virus attacks the immune system, rendering it powerless to fight off infection.
Meaning you're getting parasitic infections, bacterial infections, viral infections that a normal body, a normal immune system would have easily conquered. But now, since you're unable to fight those viruses, those bacteria, and those parasitic infections, that now it's going to kill you. The environment will kill you.
Dr. Schaub now realized that Steve had PCP, a unique strain of pneumonia that often won't show up on a chest x-ray, but is the most common infection in people with AIDS. It was PCP pneumonia that had been causing all of Steve's symptoms.
My first thoughts were where and when. You know, it was the job. There was always exposures to blood. We were in a bad side of town. There were stabbings, there were shootings.
Unfortunately, paramedics have a 100% exposure chance to communicable diseases, AIDS being one of them.
He doesn't use drugs. He gets tested for drugs. He never had, committed any type of adultery, so it was just a clear-cut answer for us.
We realized immediately that Melissa needed to be tested.
Within a half an hour, they were drawing my blood.
We thought for sure, there's no way. If I had this disease, certainly I had given it to her.
The next few hours were excruciating for Steve and Melissa as they waited for the results of the blood test.
When the result came back, I just remember, we just cried. We were so happy that she didn't have it. And the infectious disease doctor assured us that if she didn't have it, it was impossible for the kids to have it. And it was the best news that we had heard in a long, long time.
After 6 months of searching, Steve finally had his diagnosis. But now he had to fight the infection that was threatening to take his life.
I started taking the drugs immediately to help with the PCP pneumonia. I remember the doctors telling me, "You're gonna get better, but you will probably get worse before you get better." I remember thinking, how can I possibly get worse than this?
Once Steve was diagnosed and treated, he was back to work in approximately 3 months.
Because of his HIV status, Steve had to give up his paramedic duties and become a full-time firefighter. And after a short time back on the job, he made a tough decision.
I probably should retire. Going into burning buildings with my T-cell count, all the carcinogens that was breathing in, it just wasn't a very good place to be. When I did leave, at least I was able to leave the job on my own terms.
Today, Steve has his illness under control, but it will be a lifelong challenge.
If Steve had this infection 5 years ago, this disease would take his life. But today, because of the antiviral agents and the type of medications that we use, that Steve's prognosis is actually quite good. We now look at HIV as more of a chronic disease rather than a disease that takes lives.
Doctors are very optimistic. They tell me all the time, they think that if I can just stay healthy now, they said that at some point in time there's going to be a cure.
Steve's future looks good, but he still wonders how such a simple test slipped through the cracks.
Every test, your exam, your blood work, your x-rays, and the whole thing is just pieces of a puzzle that you eventually, as a physician, put together and attempt to form a picture of what the problem is. Is it perfect? It's not a perfect science.
Fortunately for Steve, one piece of his puzzle was Dr. Schaub, a former paramedic who knew what it meant to be an EMT.
He had told me, I know what kind of environment you work in. This is a test we need to do.
To be a firefighter, you have to be willing to run in when the other people are running out. They know that they're putting themselves in danger, and that's just what firefighters do.
In retrospect, there's nothing I would change. Is there a day that I don't know about that maybe I wish I would have had a cut covered up? Certainly, but there's nothing that I would change. If I had it to do all over again, I'd do it the same way.